Dentists of Reddit, what toothpaste do you actually recommend? My best friend's dad is a dentist, and I actually asked him this question a few years ago. His answer: modern toothpastes are all held to such a high standard that you really can't go wrong. It's more important that you brush properly and floss regularly. I regularly floss once in a while. Does that count? Cheap toothpaste works just fine. The important part is that it contains fluoride, and GT, 1'OOO ppm for adults. And you have to brush, gently, not forcefully. No point making your gums bleed, for a full 2-3 minutes. With a toothbrush that isn't frayed, so get a new one per month. Fluoride works but it's not instantaneous, so in addition to mechanical cleaning, brushing, it just needs time. If you're a quick 15-second brusher, then no matter how good your toothpaste is, it just won't do much. It's just like a washing machine. Detergent obviously works, but the effect is not instantaneous either, hence it's not done in a minute. When I go to the dentist, they always recommend S type of toothpaste, like cavity prevention or for sensitive teeth, instead of a brand. I got something similar when I had my eyes examined. The eye doctor wasn't actually allowed to recommend a specific store to buy glasses. I ended up pointing out I'd recently moved to a new country, had no idea what their stores that sold glasses were even called, and I was now asking her as a private person where she bought her glasses. Not a dentist now, but I was from 1947 to 1968. I would always recommend Camel cigarettes TM. I used to use Colgate and my teeth were super sensitive to cold drinks/food. Started using Sensodyne and no more pain when I drink/eat cold stuff. I buy Canadian Sensodyne with Novomin, a drug the US FDA doesn't allow hasn't yet reviewed and allowed, through Amazon. Shit is unbelievable. The FDA has nothing to do with it. It actually was sold over the counter in the US at one time. When GlaxoSmithKline bought the company that made it, they pulled it and only let it be sold through dentists' offices. I buy mine on Amazon from the UK. As long as it's got fluoride and not charcoal, it's good. Spit, don't rinse. The whole point of using paste is cleaning, then leaving tooth protective stuff on your teeth. Rinsing washes it off. It's like putting your coat on to keep warm to go out to not get wet, then taking it off when you go outside. It's a habit hard to kick if you are used to it. It's the technique that makes a difference. Where the gum meets the tooth, front and back, twice a day for 2 minutes, and in between with interdental brushes/floss once a day. Electric brushes with pressure sensors and timers make brushing piss easy and can even be enjoyable. Change heads every 3 months like you should be doing with your brush anyway, and if it's wearing too quickly you need to be more gentle. Also, if you have to use mouthwash, preferably with fluoride in, use it 30 minutes after brushing or during the day. You don't want to wash off what you just spent 2 minutes putting on. Note: I'm dental nurse, not dentist, but give oral health advice most days. Just brush regularly, a decent one would work. Only thing you should avoid is cheap whitening ones. They destroy your enamel slowly under the work of whitening. Here's a real answer. MURDH. There's a prescription fluoride toothpaste by 3M called Clinpro 5000, or alternatively Prevident by Colgate, but I'm not a huge fan of it. That is super gentle and inoffensive in taste. It's almost kind of bland, and has hardly any grit to it, so it's very safe for enamel. It's 1% fluoride, and not only does it prevent cavities, but it will help to prevent recurrent decay around any existing restorations you have, and is great for sensitivity. The only con is you do have to buy it from your dental office. Anyone used Elmex? Found in Germany and made with sodium monofluorophosphate and another ingredient which is not sodium fluoride. Keen to get the Reddit view on this product. Good old Elmex. I think every German has used it at least once in their life. Most probably as a kid. It's actually really good, and even though I'm using a different brand now, a lot of my friends still use Elmex. The TV commercials always recommended to brush with Aronal in the morning and to use Elmex in the evening. No idea what the difference is, but lots of people swear by that method. Blah blah, not a dentist, but mine tells me to use whatever brand doesn't have SLS since it causes canker sores. Have a good friend dentist, and his answer to this is the one you will use that has fluoride and no polishing beads. Fun fact, There's a chemical additive, Novamin, that is widely available in Europe that helps regenerate tooth enamel. In America, this chemical is not available without a prescription. Thanks to shitty American corporations, if you want quality toothpaste, you have to order it from overseas. Novamin is awesome. I had a pain in my tooth, my dentist did an x-ray and didn't see a cavity. I figured it was some microscopic thing. I use this toothpaste, no more pain. Guessing 9/10 pick the same one. Jumping near the top to say fuck up for not adding a serious tag. Not many dentists on Reddit. I doubt it. People like that are busy making money and enjoying it. Dental student here. 1. You need an adult toothpaste if you are older than 6 years old and it needs to contain fluoride, ideally greater than 1000 parts per million. 2. If you have a bunch of cavities or high risk of cavities, e.g. having dry mouth, then you must ask your doc for a prescription toothpaste of 5000 parts per million. 3. The most important step is to spit, not rinse your toothpaste out. Spit as much as you can out. Rinsing with water or Listerine after you brush washes the fluoride down the drain and it needs to stay on your teeth for longer. For most of my patients, the only ingredients I care about are fluoride, which has the same concentration in all over-the-counter U.S. toothpastes, and potassium nitrate for the surprisingly large number of people with sensitivity. As others have mentioned, hands down the best toothpaste is the one that you will use. At the end of the day it is the mechanical disruption of plaque from the toothbrush, floss, that has the biggest impact on both cavity risk and gum health. That being said, there are a few nuances to add. More and more brands are adding or upping the amount of sodium lauryl sulfate, SLS, which is a cheap detergent that can cause a tissue sloughing reaction in some people. It's not harmful in the long term, usually goes away, and most of the time people don't even realize they have it, but I still have a hard time being okay with it. I also personally stay away from many toothpastes containing triclosan, such as the Colgate Total line. It's not my area of expertise, but it has enough linkages with bacterial resistance and endocrine disruption that I choose to avoid it. When it comes to whitening toothpastes, I have yet to hear an argument as to how or why they work. Because it is a cosmetic claim, the manufacturers do not have to provide any proof, and the independent literature has been unable to find any evidence that it has any whitening action. Along those lines, I counsel my patient to avoid any toothpastes or rinses with hydrogen peroxide, as I have heard some early discussion of a very small increased cancer risk. Likewise, charcoal is often an enamel destroyer. When it comes to the electric versus manual toothbrush debate, they are theoretically identical. But as many other have mentioned, my hygienists can usually tell when someone makes the switch. There are a few studies showing that the timer function of the electric toothbrush is actually the key, in that it gets people to brush longer. In short, I am a dentist, and have the classic, super cheap Crest cavity protection toothpaste in my bathroom that I put on a manual toothbrush, and I use a water pick every night. I have no mouthwash in my apartment, and my lone spool of floss lives in my travel bag. I swear to God, if somebody recommends Tom's of Maine. I had a friend whose parents allowed 0 sugar in the house. She said she'd take the Tom's toothpaste and hide under the dining room table so she could eat it out of the tube. I can't imagine being so desperate for something sweet that I'd eat toothpaste to get it. I have sensitive teeth, and my most recent doc suggested Sensodyne Repair. This hurts every time it comes into contact with my teeth, just as if drinking cold or eating chocolate/sweets. Horrible stuff and does not help. Edit, Sensodyne Repair and Protect, powered by Novamin, with fluoride, SmithKline Beecham, UK. Really? I frickin' love Sensodyne. My teeth got both less sensitive and whiter. I'm not a dentist, but my teeth are less sensitive after using Sensodyne for years. It's a little more expensive, but toothpaste lasts a long time, so even if you're using the most expensive kind, it's not that tough to set a few extra bucks aside for it. You only get ~1-2 sets of teeth, might as well pamper them. I remember as a kid I didn't really take care of my teeth, and then they all, one by one, fell out. I panicked. It was honestly horrible. And then, it was as if the dental gods smiled down on me with their perfectly cultivated smiles and granted me new teeth that began to grow back through my gums. I will never forget that, as I doubt they will allow me another set. No toothpaste, so you have to go to the dentist a lot. I'm just here for the 9/10ths dentist. Toothpaste isn't super important. Brushing technique and flossing are what we're really worried about. Floss before you brush, making a C shape with the floss. Use the C shape to scrape from bottom to top of the tooth, making sure to get under your gums. We use two brushing techniques, the base technique and the rolling stroke technique. First we do the base, turning our brush towards the gums at a 45-degree angle. Use this angle to get some of the bristles under the gums. Go back and forth from one side of the mouth to the other. Next use the rolling stroke technique, where you place the bristles parallel to your teeth with the bristles facing the gums. Use gentle swiping motions to swipe towards the chewing surface of your teeth. There are a lot of YouTube videos about these techniques that can really help you work it out. The one that give me free product. Last time this was posted, the top answer was anything that doesn't have artificial coloring. Not bleach. What's it like to be able to afford to go to the dentist? Not a dentist, but since I've started going to KKK rallies my teeth have become whiter. Fun fact, I'm actually the 10th dentist that recommends nobody. Been told to floss and brush more by dentist and never cared much. Reddit tells me to floss and brush more and now I'm doing it every other hour. Not a dentist, but toothpaste that includes fluoride that tastes okay enough for you to actually use it. Fluoride isn't for mind control, it's for helping you keep your teeth. My father says it doesn't necessarily matter, you want to make sure it has fluoride and gets the job done. Bigger recommendation, actually brushing your teeth often enough and flossing. My father is a dentist and doesn't worry about it too much. For personal use we always used whatever the free box they got at work was. Colgate was common and Tom's was common. One time they tried this cinnamon one, but really pretty much anything that didn't taste gross. More important than the toothpaste you use is flossing. My father would rather see you floss every day than brush twice a day. It really doesn't matter what toothpaste you use, was told this by several dentists. All name brands have fluoride and all the necessary ingredients you need to get your teeth clean. What's more important is how you brush and floss. If you just move the toothbrush back and forth across your teeth, you may as well just rinse with mouthwash, because all you doing is freshening your breath. You have to clean your teeth at the base by your gums and prevent plaque buildup that will lead to gum disease like gingivitis. I also use a water pick and Sonicare toothbrush which vibrates the hair out of your teeth, technical dental term there, and takes some getting used to but works much better than any other toothbrush I've ever used. Source: advice from dentists and dental hygiene specialists treating past history of gum disease due to poor dental habits. Does stannous fluoride really make a difference versus sodium fluoride? I had a terrible dentist for most of my life until about 3 years ago. We just didn't know. Started off with some shady billing attempts. Charged my dad for work they hadn't even decided if it would be necessary yet. Dad pulled the plug pretty quick on that and I followed his lead. After I went to a new dentist, age 25, the hygienist said I still have glue on my teeth. Braces, spacers, and mild lower jaw surgery. I told her yeah, my other dentist office used to say that every time I was in. She looked at me eyes wide with shock. I had my braces removed and was fitted for retainers when I was 13. In 12 years the other office never once thought to tell me or my parents that I had bacteria traps all over my teeth, so now my teeth are riddled with, blessedly shallow, cavities and they play down the seriousness of one of my upper wisdom teeth coming in weird. It was basically rotting in my mouth and affected the tooth in front so much I almost had to have it removed too.